Hi, I'm Dr. Moshe Roth. I practice at Family Eye Care in Old Bridge, New Jersey. If you suffer from headaches and migraines, we may have a solution for you. Syntonic phototherapy and vision therapy may help solve your problems. If you suffer from frequent headaches, you know how debilitating they can be. They just suck. They suck your energy and they make you feel wasted, and they're painful, and they steal away your valuable time. If medications haven't solved your problem, and if you don't like taking medication, then syntonic phototherapy may give you the relief that you're looking for. Headaches can be divided into two categories. Primary headaches. These are headaches that we can't find a reason for. For example, cluster headaches or migraines. Secondary headaches are headaches that we can link to something. For example, tension or stress-related headaches. Some foods or medication can bring on a secondary headache. If you've had a headache when having the flu, for example, that's a secondary headache. Illness or infection, lack of sleep, dehydration can cause secondary headaches. Many tension headaches are caused by visual issues like eye strain and focusing difficulties and poor eye teaming. Many people who use computers and cell phones and other small electronic media feel eye strain and headaches. Syntonic phototherapy treats imbalance between the two parts of the autonomic nervous system, the sympathetic nervous system and the parasympathetic nervous system. Now, these two parts of the nervous system have to work in tandem. Syntonic phototherapy uses color filters that are specific for specific problems. So here's an example of one of our tools to help diagnose these problems. You may be able to see that this is red, and this is orange, and this is yellow, and this is green. Different filters are used, and different combinations of filters are used for different types of problems. The filters are personalized for each individual based on the number of diagnostic factors, and we use certain filters for headaches and for migraines. Vision therapy treats the imbalance of the visual system, either inputting visual information, processing visual information, or in the motor output of where the two eyes are pointing. These show up as problems in eye teaming and tracking, for example. Problems in vision can lead to headaches. Solving the underlying problem can bring relief. The first step is to find the source of the problem. Many people who have headaches realize that there's a vision problem at the root of their headache. The problem goes undetected and misdiagnosed because not all eye doctors look for the same things. We don't all do the same types of tests, and not all eye doctors test for these specific types of problems. These problems are usually not detected in a general eye examination unless the eye doctor knows what to look for. Some eye doctors concentrate on eye health of the eye itself, while some are experts in eye surgery and eye disease. The underlying reason for a vision-based headache is not a medical issue in the eye, but rather it's a functional problem of how the two eyes work or don't work together as a team, and some are brain-based problems. What kind of vision problems lead to frequent headaches? Well, problems with binocularity, how the two eyes line up to produce one image. If you put your palm in front of you and one palm away from you, this is kind of like how I'm seeing with one eye, and this is how I'm seeing with the other eye. When we look at a computer screen, we have to use the two eyes together as a team. When these two line up perfectly, great, then we see just one picture. But if we have difficulty or struggle in doing that, then that can lead to a headache. Physical focusing, the accommodative system inside the eye helps us focus similar to a camera that has to focus. Convergence means the ability to bring our eyes in. Divergence means bring our eyes out so that they're parallel. And strabismus means an eye that turns out or turns in or turns up relative to the other. A comprehensive eye examination that looks for more than just eye health issues is able to identify these problems. For example, the tests have to include how the two eyes work together to get one picture in the brain, and how they work as a team, both off at a distance and up close. In order to identify these problems, the doctor must test for the near vision skills that are needed for reading and for working on computer. Once we've completed a vision evaluation and arrived at a diagnosis, we can then design a program of vision therapy to solve these problems. Vision therapy is different than physical therapy or occupational therapy and is specific to addressing the problems of the visual system. We prescribe a program that is problem-directed using special equipment, lenses, prisms, filters, and computers. It's done in a specific logical sequence approach, similar to a curriculum that might be used when teaching a class, whether it's a third grade curriculum or it could be a college physics curriculum. Vision therapy gives somebody the tools and enables people to learn how to use their eyes to work together. This then enhances vision and relieves headaches and other vision-related symptoms. In our office, we offer vision therapy in conjunction with Syntonic Phototherapy. Syntonic Phototherapy has been around for about 100 years to treat eye conditions. Phototherapy balances the autonomic nervous system, which controls the perceptual visual field. Patients use goggles similar to these with special color filters at home, and they see us periodically in the office so we can monitor how they're progressing and getting better. Children with learning disabilities and adults under visual stress commonly have a reduced or a smaller perceptual visual field, and they're unaware of it. Light entering the eyes joins together brain centers to allow normal visual processing to happen. The retina, which is the back part of the eye, is actually part of the brain, and it's the reason that reaching the brain through the eyes is so effective. In phototherapy, specific color lenses are worn based on the individual's problem. Typically, they're worn for about 20 minutes several times a week while looking into a light that's a full spectrum bulb. Wavelengths, meaning lens colors, that range along the visual spectrum, red, orange, yellow, lime green, aqua green to dark blue and purple, are used for specific problems. Each wavelength, and often the combinations of wavelengths, are used to treat an assortment of visual problems. What problems can we improve with vision therapy and light therapy? Well, they include headaches and migraines, convergence insufficiency and convergence excess. That means when the eyes don't point in enough or they point in too much. Esotropia and exotropia, meaning when one eye points in relative to the other or one eye points out relative to the other. Vertical heterophoria and vertical strabismus means when the eyes don't line up in the vertical plane. Reduced concentration and comprehension, dizziness and balance issues, often because there's a mismatch between the visual system and the balance system, the vestibular system that's in the inner ear. And that sometimes causes motion sickness. When somebody can't use their two eyes together as a team, that alters their depth perception, and it can be emotionally fatiguing. What conditions cause headaches? Well, eye strain and fatigue, dry, red, watery or itchy eyes, blurry vision, focusing and tracking difficulties, sensitivity to light, double vision, brain injuries like a stroke or concussion, or a traumatic brain injury like a car accident or a fall. If you have any of these problems, we can help. Call us at 732-679-2020. We're located at Family Eye Care in Old Bridge, New Jersey.